Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, summer is almost come and gone. It is the end of August. Have you had a great summer? Are you still going on holiday? Labor Day is just around the corner. Did you wear your sunscreen? Did you spend time outside? Did you drink a lot of water? Did you spend more time with your family? And as we say here at Healthline all the time, did you put down your iPhone, turn off your iPad, turn off the TV, and spend time with your family and your friends? One thing that we discuss all the time is that obesity is on a rise. Over 75% of this country is obese. So turn everything off, go outside and spend time with your family and your friends. Communicate. They're called relationships for a reason. Okay, as I said, it's summer. And it's about being outside, being in the water, being in the parks, being with your friends. And what happens when you spend so much time in the sun? Skin cancer, melanoma, rashes, heat rashes, things that just come up that you're like, what is this? And joining us today are oncologists from Glendale Adventist Medical Center, Dr. Mihran, Shirinian, and Dr. Amy Patel. But before we spend time with our superstar doctors, let me just remind you that you can visit us on social media, and it's all about Healthline. Join us on Facebook, Twitter, YouTube, and of course LinkedIn to learn more about the special services, awards, and new physicians, and of course some of my health tips to help you be as healthy as you can be. And also to learn more about the offices, to learn more about the services offered at Glendale Adventist Medical Center, please visit the website adventisthealth.org/Glendale. You can also call the Glendale Adventist Medical Center's personalized physician referral, I'm going to call it the hotline, 818-409-8100, and they're there to guide you and help you with anything you need. Since we're talking about melanoma and cancer, I also want to do a huge shout out to Cancer Services at Glendale Adventist Medical Center. GAMC is the only cancer center program in Glendale to be accredited by the American College of Surgeons. Commission on Cancer as a community hospital, comprehensive cancer program. So as part of these exceptional standards, the people at Glendale Adventist Medical Center encourage and promote communication and cooperation among surgeons, medical and radiation oncologists, diagnostic radiologists, pathologists, and other cancer specialists, resulting in improved patient care. Glendale Adventist's mission is you, whole person care. So anything you need to know is again at 818-409-8100 and on the website. Okay, now, it's all about our doctors and all you need to know in regards to melanoma and taking care of your skin when you're out in the sun. Dr. Shirinian, Dr. Patel, welcome.
Thank you.
Thank you. Skin cancer, melanoma, it's on a huge rise. What? I'm going to go ladies first, doctor.
Sure.
See, gentleman lives, being a gentleman lives.
You.
Dr. Patel, why do you think it's so prevalent these days?
I think it's on rise not just in US but worldwide. There's probably cumulative effect. We were just talking global warming.
So you in fact believe that global warming is
possible?
Okay.
There's
Okay.
no data on those things,
Okay,
but this is
possible.
just possibility.
Okay.
It's rising all over the world. Also, there's delayed effect. If the sun exposure happened in your childhood or adolescence, that has the highest incidence of melanoma resulting later in your age. So I'm not sure if the tanning was much more prevalent before compared to now, and now we're seeing the results of that. But honestly, I'm not sure why it's on the rise, but it's definitely on the rise. There are 76,000 new melanoma cases in 2016 for US.
That's crazy.
Yes, and out of those, close to 10,000, 9,900 deaths from invasive or metastatic melanoma resulting.
Which is terrible. And doctor, since we've had this conversation before, welcome back. Why do you think it's so high? Same thing?
Yeah, I mean, plus, you know, the ozone layer has been affected. I mean, people are living longer, so if you're exposed to sun, you know, like Dr. Patel said in an earlier, you know, when you were younger, you have a higher chance of developing something later on. So melanoma doesn't have to develop immediately after you're exposed to sun. It can develop many, many years later. People are living longer, the ozone layer is affected. Actually, it's the highest, I mean, percentage-wise, it's the highest cancer that has the increasing rate compared to any other cancer in the United States. Even like pancreatic cancer, which is on the rise, this one has the highest percentage of rise over the last 8 to 10 years. So it is going to become a huge problem. I mean, the numbers are rising very quickly.
And we're still spending so much time out in the sun. So I have a question, and we're going to get the answer. So don't go away. More with Dr. Patel and Dr. Shirinian when we come back. Couple things. Have a glass of water. I promote lots of water when we do the show. Here's a question. Do you believe that skin has memory? More on melanoma and how to take care of your skin this summer and into the fall and for the rest of your life when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. According to the American Cancer Society, skin cancer is the most common of all cancer types. Now listen to this number, more than 3.5 million cases of non-melanoma skin cancer are diagnosed each year in the United States, and more than 76,000 cases of melanoma, the most serious form of skin cancer anywhere, are expected to be diagnosed this year in 2016. The numbers are staggering. So joining me are oncologists from Glendale Adventist Medical Center, Dr. Mihran Shirinian and Dr. Amy Patel. Doctors, and I asked you before we went to break if skin has memory, because our skin is the largest living organ. You were saying, doctor, that we were talking a little bit about global warming. The ozone layer's gone. A lot of it's gone. A lot of people would lay out and burn, and days of baby oil and number 2 sunscreen. We're talking like we would turn into pieces of bacon.
Yes.
Which I hate to say it, but we would. We didn't take that much care of our skin. Fast forward to somebody like me that laid out 30 years ago, careless. If I burned, I burned, took care of it. Does my skin remember that? So does skin have memory?
I would say yes.
Okay, doctor?
Yeah, I mean, yes and no. I mean, from the studies, we know that if someone has sustained a burn, even if it's 50, 60, 70 years ago, you can develop skin cancer in that burned area. Not necessarily melanoma. You can develop a squamous cell cancer, you can develop a melanoma. So we know that the areas that are burned heavily, regardless of whether it's a sunburn or some other form of burn.
So any type of burn.
Yeah.
So then does it lay dormant? Does the cancer lay dormant?
No, it takes a long time for the cancer to develop.
Okay.
In other words, like smoking. If you smoke 50 years, 60 years, you might develop lung cancer after 50 years. It's not that the lung cancer developed from the beginning. It's just that it got to that point of becoming lung cancer. Same thing happens with skin. Now, does the memory apply to the rest of the body? No one has ever proven that. So we know that heavily burned areas of the skin have a higher risk of developing skin cancer down the line.
Okay.
But the rest of the body, no one has proven that. It's possible that has memory too.
So basically you're saying yes.
I would think so. And I think it probably has, it takes one hit, second hit, third hit before it actually manifests as a cancer. Because it's like a genetic mutation that's going to happen. So majority of about 90% of the melanomas are de novo or sporadic. That means that the person who got melanoma didn't inherit that as a genetic mutation from parents.
So melanoma is not hereditary?
Not all the cases.
In a small percent.
Less than 10%.
Are there any nationalities that are more susceptible to melanoma?
Certain phenotypes.
Yes.
Certain traits, yes.
Okay. What are some of those traits?
The fair skin.
Fair skin. Okay.
Hair type, blonde and red hair.
Blonde and red.
And even eye colors,
Really,
lighter eyes,
okay.
Blue, green, hazel.
Okay.
Those are the phenotype that are more susceptible for the cancer, yes, melanoma development.
Who gets melanoma more, men or women?
It's about equal, but I mean, lately the studies have shown that men probably are developing more melanomas than women by a very small percentage, but it used to be equal. But the site of melanomas developed in men and women are different. Women have a higher incidence of developing melanomas in the lower extremities, while men have a higher incidence of developing on the trunk and head and neck area.
Doctor, so when you say extremities, For the women, you're talking from the waist down, the legs.
That's right.
The trunk is the torso for the men, and the arms, and then what else?
The head and neck area.
The head, it's more so on men.
More so on men, yes. Women can develop that too, but it's more so on men, and it has a poorer prognosis if you develop a melanoma of the head and neck versus the torso or the lower extremities.
Why is it so different for men and women?
No one actually knows exactly. I mean, all the studies pretty much have shown the same, distribution, but there's no clear-cut explanation why it happens more on the torso in men and the head and neck. I mean, head and neck would be reasonable because of sun exposure. Why the torso versus lower extremities? No one has a clear-cut explanation of that.
Let's go back to basics. So what are the different types of skin cancer? I know we've been saying melanoma. Dr. Patel, what exactly is melanoma?
So going back to your first question, the different types of cancer, the three major ones. There are a few rare ones.
Okay.
So we're going to focus on the three major ones, which is melanoma number one. The most common is basal cell carcinoma, in fact.
And what is
the
that?
Second next, so basal cell carcinoma is from the base, it's basal layer of the epidermis and dermis, where it's arising from. It's from the non-melanocytes. It's from the epidermal cells of the skin.
And when you say dermis, just for people that don't know, the epidermis is your skin. It's your
there's
skin.
a top layer, right?
Top
the
layer.
skin has two layers, epidermis and dermis.
Okay.
So the topmost is epidermis, the bottom one is dermis.
Okay.
And then from there on, it's non-skin part, which is subcutaneous tissue.
Got it.
So, so there's two broad categories: melanoma skin cancer and non-melanoma skin cancer.
Okay.
So in non-melanoma, you have basal cell, which is
Okay.
the most common.
And that's surface?
Yes.
That's the surface.
Okay.
Yeah. And then the squamous cell cancer, which is the second most.
Dermis.
Right, that's
Okay.
correct. From the basal layer is the basal cell,
Okay.
and a squamous cell from the topmost layer. In fact, I do go back. Squamous cell is from the topmost layer,
Okay.
and the basal cell is from the deeper cell layers.
Got it.
But these are still two non-melanoma cell.
Okay.
Take it back from
Melanocytes.
non-melanocyte cells, while melanoma is from the melanocytes,
Got it.
which is the pigment-forming cells of your skin.
So
So these are your three broad categories.
So do them again, 1, 2, 3. Number one,
Number one is basal cell,
Basal
from the
cell.
basal layer of your skin.
number 2,
Number two is the squamous cell, which is from the topmost layer of your skin.
and number 3.
And number three is melanoma, from the melanocytes, which are the pigment-forming cells.
And all of them are dangerous.
Well, the most dangerous, the highest mortality is from the melanoma,
Okay.
which is actually the least common. It's only 1% of all skin types.
Why is that?
It's rather than just being basal cell and squamous cell are locally invasive,
Okay.
rarely do they metastasize.
Okay.
They're picked up early because they're locally invasive. You're going to see some ulceration, so it's picked up. While melanoma, being aggressive in nature to start with, it has more malignant potential. Sometimes it goes unnoticed before it starts spreading to other parts of your body.
Yeah. Keep also in mind that the higher the epidermis and the dermis are directly exposed to the sun. Melanocytes are further inside. In other words, and they're more exposed. I mean, ultraviolet rays are the ones that cause the melanocytes to transform into melanoma. So you have to have ultraviolet ray exposure, specifically ultraviolet B and maybe ultraviolet, and not maybe, but also ultraviolet A. But the other skin cancers like basal cell or squamous cell are direct sun exposure on the skin. So it's a higher exposure to those. In other words, everyone is exposed to the sun. But the ultraviolet rays, ultraviolet B, ultraviolet A, have to go further down to affect the melanocytes and to develop melanoma. So melanoma, like Dr. Patel said, is only 1% of all types of skin cancer, even though skin cancer is the most common type of cancer in the world. Most of them are either basal cell or squamous cell. Basal cell has a very low potential for penetrating and spreading. So if it's diagnosed early, it can be excised and the patient and the person is completely cured. If you leave a basal cell without taking care of it, it can spread diagonally around the skin and it can eventually start penetrating. Squamous cell is a little bit more aggressive, but compared again to melanoma, nothing. There's no comparison. And by doing a good excision, you can eliminate the disease. Melanoma, on the other hand, can spread and can spread very aggressively, either to the lymph nodes or sometimes even directly through the bloodstream.
That's great, Doc. And when we come back, we're going to share with you what to look for, signs and symptoms of melanoma. Don't go away. Welcome back to Healthline. The entire conversation is about you and your skin and melanoma. Before we dive into signs and symptoms, we're going to find out a little bit as to where our doctors come from. Joining us are oncologists from Glendale Adventist Medical Center, Dr. Mihran Shirinian and Dr. Amy Patel. Doctor, a little bit of your history. Where did you go to school and what brought you to Glendale Adventist Medical Center?
So I graduated from Cairo University in Egypt. I did my internal medicine training at Cook County Hospital in Chicago. I did my fellowship in hematology oncology at MD Anderson Cancer Center in Houston. Stayed there for 3.5 years on staff. I was an assistant professor before coming to Glendale. This is my 24th year in private practice at Glendale. Thank you.
And when you were in Egypt, you saw the Sphinx and all the pyramids and everything?
Sure, I went inside the pyramid.
Stop it. Did you ride a camel?
Yeah, of course.
Stop it. Okay, wow. Okay, I digress. Okay. Dr. Patel, what is your history?
Well, my background is I graduated from medical school from India.
Okay.
It's Pune University. Right after that, I came here and did my residency at Louisiana State University in Shreveport and moved to California. I was able to do hospitalist work. So I worked as an internist for the first almost 4 years. Part of that was at Glendale Adventist, 2007 through 2009. And then I was fortunate enough to actually start my own practice, internal medicine private practice. That was right across from Glendale Adventist Medical Center. I was very fortunate. But while during that primary care practice, I developed such a good bonding with patients. And I thought oncology is one field that requires that the most. They're your patient and they're your patient for the rest of their life.
It's a relationship.
Yes.
It is.
It really is. And it's
that
not just...
really motivated me. So I went back to doing fellowship, specialization. Okay. And I did at the same place, Louisiana State University in Shreveport. They welcomed me to do the fellowship, and here I am. I just graduated, and I'm joining Dr. Shirinian's practice in Glendale.
And now you're a powerhouse team.
Yes, we're hoping so.
One thing that I really respect that you said and that we've talked about before and when we're not filming is how important it is to have a relationship with your doctor.
Yes.
And one thing that I want to say that a lot of people don't do is they're not fearlessly honest. Be fearlessly honest, because I'm sure there's nothing you haven't heard. And that one little sign or that one little symptom or that one little thing could change the entire puzzle piece.
Absolutely.
The puzzle game.
Absolutely.
Well, here's to, first of all, riding camel soon. And I want to come with you to India one day if you ever go back.
Please do so, yes.
We were talking about the 3 types of skin cancer.
Yes.
We were talking about specifically melanoma. What are some of the signs and symptoms? Because I get scanned every year. I do a full body search on myself. Like I will remove all my clothes, look at myself all the time to see if anything looks different. We talk a lot about that on Healthline, about you are the captain of your ship. Like take off all your clothes and look at your entire body.
That's right.
And if you're in a relationship, have your spouse or your partner do the same and just be fearlessly honest.
Absolutely.
Because of course, they can see things you can't.
Yes.
Yeah. What is someone looking for? Like we have moles and we have spots. What are we looking for in regards to melanoma?
And I mean, you mentioned the most important thing. You have to be familiar with your body. Mm-hmm. Like we advocate women to do breast self-exams. This is the same thing. You have to self-examine yourself. Your partner, your spouse can do that. Women are much better in...
Yeah, women talk a lot more than men.
Yeah. I mean, the studies have shown women are much better in examining themselves and examining their partners versus men. Mm-hmm. But anyway, the 4 signs, I mean, all of us have nevi or moles and stuff like that. So it's something called ABCD, asymmetry. If the lesion is asymmetrical, if the borders are not smooth, that's the B. See if there's color variations. In other words, you have a mole that has several colors, like bluish, pinkish, blackish, versus just being a uniformly colored.
Okay, standard. Okay, great. Okay, so different colors.
Right.
And then.
And the D is diameter. In other words, if it's over 5 millimeters, that's also a higher incidence that there might be something there. Again, I don't want people to get paranoid, but basically those are the signs that you have to look for. And if there's any question in any of them, it's better to get medical advice, show it to your primary or a dermatologist, and they can tell you if it needs to be biopsied or not.
When you said 5 centimeters?
5 millimeters.
5 millimeters.
Half a centimeter.
Can you? How big is that? Can you?
About this much.
That would
Okay,
be more like what I always hear is like a pencil eraser.
Okay, pencil eraser.
Pencil eraser. A little more than that, yeah.
More than that, and then what is the most prominent thing to see? Is it the discoloration, the changing in color?
Yeah, well, that's another thing. In other words, this is in an existing mole. In
Okay.
other words, then you have a whole slew of other things to look for. If something is changing.
So you're talking about
Rapidly.
something that is existing, okay.
That's right.
Okay, but if, how long does it take for melanoma to come up?
It could be rapid. It
Okay.
could be rapid. It could start from an existing nevus
Okay.
or a mole.
A mole.
And that's about 10 to 20%. We talked about 10% or less could be inherited.
Okay.
These we're talking about another 10 to 20%. They develop from pre-existing nevus.
Okay.
So if you see, there is another sign called ugly duckling. If something that stands out, if you have, let's say on your body, you know your body and you have like 15 moles, and they're surrounding in the same, maybe concentrated in the same part of your body, and then one of those nevi or moles is standing out different from others.
Okay.
That could be a warning. Or something that's rapidly changing. If you've seen it that it's been this way for a while and now it's changing. It's growing, it's changing the diameter, it's changing the color.
Do they bleed?
They could.
They could
Bleeding,
bleed.
Okay.
ulceration, pain.
Okay.
Those are the signs as well.
Or
Warning
spreading,
signs.
or
Spreading.
getting bigger, or getting bumpy. In other words, growing outwards. Those
Yes,
are also
nodular.
signs that you would worry that something is changing.
If it from being flat to it rising now from
Right.
on the surface.
Okay, doctors, hold that thought. More with Dr. Shirinian and Dr. Patel when we come back. Don't go away. Welcome back to Healthline. The conversation has been all about your skin and melanoma. Joining us are oncologists from Glendale Adventist Medical Center, Dr. Amy Patel and Dr. Mihran Shirinian. Like I said, doctors, somebody comes in with what they think is a mole. Then how do you make the diagnosis that it's then melanoma?
So I would say if there is already enough concern, the doctor is going to look into that. They're going to check out, first of all, the entire body skin exam needs to be done. And if there is enough, on clinical exam, there is enough concern that this could be a malignant lesion. The most important thing to do, like with any other cancer, is take a tissue sample. So biopsy. That's the most important thing to do.
Do you remove it and then take the biopsy?
Yes, excision
Depending.
of that lesion
Okay.
or biopsy.
Yeah, I mean, if it's a relatively small lesion, the biopsy is going to be excisional,
The
meaning
whole
the
thing.
whole thing is removed.
Okay.
If it's a bigger lesion, you might just want to take a sample. But again, samples might not be as effective because there might not be melanoma in the whole thing.
Got it.
Right.
So removing the whole thing is probably the best thing to do. And it's the only way to make a diagnosis. I mean,
Final
people have tried to
diagnosis.
develop handheld microscopes with illumination and stuff like that. I mean, they have some successes, some failures. The only thing you can do to be able to answer that question once and for all is a biopsy.
Biopsy, okay, so biopsy comes back positive. Then what are some of the treatments?
There are a lot of treatment options we were discussing earlier. And as I said, like with any other cancer, early detection is the key, and that's a cure, literally, pretty much for a lot of cancers, and that applies to melanoma or any other skin cancer as well. If you detect it early enough, you excise the whole thing. Negative margins, you go all around, get enough margin. There is no need for bigger excision. Any lesion that's more than 2 millimeter, about 2 centimeter margin is
Okay.
more than enough, okay? Regardless of how big it is, as long as we can get the all-around margin negative. And that's the end of the story. You pretty much can guarantee a cure. There is always never a guarantee, but that's the best we can do at early stage. Now, if there is concern enough that this is a bigger lesion, there are certain risk factors that we look for: ulceration, size, pathology, and based on those risk factors, if there is further need for any further intervention, more excision or lymph node excision, that will be determined by the doctor at that point in time.
By the team.
Yes.
prevention. Let's talk prevention then, because you said early detection is prevention.
Yes.
Right.
So talk to me, doctor, about prevention. There's so much conversation about sunscreen. Does sunscreen, in fact, fully work?
No.
Okay,
The straight answer is no. And the best way to protect yourself is to be in a building. In other words, not to be exposed to sun. The second best way to protect yourself is clothing.
Okay.
And clothing should involve a hat, because you have to cover your face too.
Long sleeves.
Long sleeves, clothing that would at least cover most, if not all, of your body. That would be the next best way. You know, sunscreens like SPF 15 and above, many people claim it's better than the lower numbers, but there are a lot of problems associated with it. And the fact is that people don't reapply them on a timely fashion. So they go and stay in the sun for like 5-6 hours. They don't reapply it on a timely fashion. They go and take a swim and they come back. They think it's still on. The sprays are not as effective as the lotions.
Okay, so you recommend more lotion instead of sprays. In regards to a timely manner, what are you suggesting? Every hour? Every hour and a half? What is your medical recommendation?
Well, I mean, it also depends on what time you're on. Like between 11 and 3 is the highest exposure to sun. I would be more careful during those hours. If it's after 4, you're probably you probably don't have to be that careful. It depends. I mean, people sweat under the sun. So when you're sweating, you're losing that too. So if you're sweating too much, obviously you have to apply it more frequently. If you're not sweating and you're numb and you feel that it's on you, you probably could do it every few hours, 3 hours, maybe every 3 to 4 hours. But studies have also shown that people who use a higher SPF tend to stay under the sun longer.
Thinking they're all protected.
But wouldn't they burn?
And then they will get burned.
Right.
So what happens is they stay till they burn. So the end result is the same. You know what I mean?
Right. Okay. Is there an SPF that you recommend? I mean, is it 15? Is it 30? Is it 45?
15 or higher is what I always found.
15 or higher.
So I don't think there is any specific. Higher is better.
I don't think they've compared 30 to 50
I don't think
or
so.
40.
15 or higher is what they recommend.
But during one of the breaks, you were saying that even the umbrellas at some of the beaches aren't
It depends on the clothing that they use, or the cloth. Sorry, I should say the cloth that they use. Certain cloths have less penetration versus more penetration, so that also depends on. So I don't think even umbrella or specific clothing that people would put on has 100% protection.
So bottom line is just be mindful.
Yes.
Even the cloud, by the way, doesn't protect you, because the ultraviolet rays
go
through
the cloud.
Yes, thicker cloud.
You want the cloud because you would get tanner.
Yeah.
Right.
So final thoughts, doctors, in regards to summer and sun exposure, and even though as we're going into fall and it's going to cool down a little bit, you can still get skin cancer from that. What are your final thoughts in regards to taking care of your skin? Dr. Patel?
I think to summarize everything that we have just said, it's summer, it's pretty hot. Hydrate yourself really well. Okay. Drink 3 liters of water every day, maybe more depending on what activities you're doing. But if you're out in sun, the best thing is to stay in shades. The most you can, because nothing is 100%. If you have to be out, enjoy, have some leisure activity. Sunscreens, the most clothing that you can do to your exposed part of your body, you're going to cover it up. Umbrella. So all put together might give you a longer protection and a better protection.
Great.
And be mindful still.
Don't get burnt.
Don't get burnt.
Yeah, I mean, you have to be completely aware of what's happening to your body. In other words, you cannot just take risks without looking for, for signs and stuff. You have to be aware of what's happening. You have to take the precautions. In other words, like Dr. Patel said, you have to take all the precautions. It doesn't mean you don't have to go outside. Maybe avoiding being outside between those hours of 11 and 3 is not a bad idea, because you can go out and enjoy yourself and swim between 8 a.m. and say 11 and maybe later on. But I wouldn't stay too long outside between 11 and 3, especially on a bright sunny day, even with all the precautions, and expect that you'll be totally safe.
Dr. Patel, Dr. Shirinian, thank you so much. And I loved what you said, both of you said about being mindful. Thank you for joining us, and thank you for being part of the conversation about your skin and what to look for. Here's the thing. Just self-exam, give yourself a self-exam. Gentlemen, check and see your pecs, see your arms, look at your legs. If you're in a relationship, have your husband, your wife, your better half. Make it fun. Explore what's going on each other's body, on your body, because you're going to see something that looks different. Remember, the most important conversation you can have is about you and your health. So why not have one right now? Gregory Zarian signing off for another episode of Healthline. We'll see you soon. Take care.